Is arthritis helped by chiropractic care? Well, that's a big question. Let's first talk about what arthritis is. Arthritis is a Latin word. Arthro means joint. Itis means inflammation. So if you just translate the word, all it means is inflammation in a joint, irritated joints. Well, irritated joints can be painful, but then you've also heard the term bone on bone, right? Someone says my hip is bone on bone, my knee is bone on bone. That's also arthritis. So that's the kind of arthritis where the cartilage is worn down. Cartilage is gone. First it thins, then it dries, then it cracks, and then it's gone, and now bone is rubbing on bone. Those are people who need replacement surgeries for their knee or their hip. Now, arthritis can affect every joint in your body. The general rule of thumb is arthritis sets in areas of immobility. Now, that is very counterintuitive, very countercultural to what people may tell you. They go, oh, you've been doing too much, and that's why you have arthritis. If you are in proper alignment, you should not develop arthritis when you do too much. It's when you do too little. It's the people that sit all day that develop more arthritis. If right now I take my elbow and I put it in a cast, even though there's nothing wrong with my elbow, and I immobilize this elbow for a year, when I take that cast off, there won't be a joint there. The bones will grow together and fuse. There won't be cartilage. It will be one solid bone, and I'll never be able to move this arm ever again. But as long as I move it once a day, every day, the bones don't fuse, they don't grow together, arthritis does not set in. Now, why could someone still get arthritis if they're moving regularly? Well, that could be an imbalance in posture, and it can be an imbalance in alignment. Imagine you're driving a car and your car is running really smooth and perfectly well, but then you hit a pothole. You hit a really nasty pothole. You think you just destroyed your car. You get out of the car, you look at the tires, they look fine. You kick the tires, they don't fall off. You assume everything's okay. So you get back in the car, keep driving, and while you're driving, it still feels fine. You don't think there's anything wrong. But then a few thousand miles down the road, the mechanic says tires on the right side of your car need to be replaced. And you go, wait a minute. I got all 4 tires from the same place at the same time. Why are these wearing out, not the others? And then he'll ask you, have you ever hit a pothole? Could it be the alignment? And you go, well, I did hit this pothole a few thousand miles back. The point is, if the alignment is off, joints wear unevenly. See, a lot of times you'll go to the doctor and the doctor will say you have arthritis in your right hip and you need to get a hip replacement. And you said, well, what caused it, doc? And the general answer is, you're getting old. Well, does that doctor know that your right hip is the same age as your left hip? So if they're getting old, why is one good and one bad? And the reason is there was probably a spinal or a pelvic misalignment. And when you were walking, you were putting undue or unbalanced pressure on one joint versus the other. That can cause the cartilage in that joint to wear out and get inflamed. Arthritis happens in the spine too. Your spine should look perfect like this. Assume that these are 2 bones in your spine. There's a disc in between. The disc is nice and full, and the joint surface is nice and smooth, and it moves very well. There's opening where the nerves come out. Now, phase 1 of arthritis in the spine is a bulge. If this gets compressed, this is usually a degenerative condition because of not moving. Immobility. The segment gets locked in place and it starts to grow together and the disc bulges. Next, you'll see bone spurs that grow on the sides and it becomes rough. It can't move properly. And if you leave it alone, the bone spurs get bigger, discs get narrower, and eventually the bones fuse together. That's arthritis in the spine. The rule of thumb, you want to prevent arthritis, move more and make sure your spine is aligned and your pelvis is level. You do those 3 things, guess what? You're going to prevent arthritis, and there's nothing that says you are destined for arthritis just because you're getting old. I hope this helps you and I hope it gives you hope. If it does, please hit the subscribe and the like button. Leave us a comment and maybe even share the video. I appreciate you. We'll talk next time.